In this video tutorial, we look at total knee replacement planning using the SmartKnee Wizard. For all knee replacement planning, check that File and Preferences have been set up for surgical knee options. Just adjusting the Smart Help to give information on this area, but select whether you wish to have femoral anterior or posterior referencing, a default valgus angle which will be used on the short AP images of the knee only, default posterior slope for the lateral tibial component, and the whole leg threshold, which is described over here, relates to the aspect ratio of long leg images. It's so they're recognised and the correct wizards appear. This can be adjusted if needed for a particular site. Always enable auto recommend if not done already, and say save to any changes made. So choosing on the blue man on the side of interest left in this case, a total knee replacement icon. Choose if necessary from another template from either the favourite or all list, and then open the images of interest. Often either short or one long leg and one short leg will be used for planning. Here we look at all as a combination to cover all features. Just scaling the images, using the automatic detector and checking the X-ray direction is correct, a marker in all cases. Starting with the full leg as the most relevant measurements are then passed to the short AP knee image, we choose SmartKnee Wizard. Roughly adjusting ankle and hip, and then zooming in by clicking on the space bar and activating the blue lens magnifier. Identify the ankle joint, and similarly identifying and moving here the handle to zoom into the area of interest, using the circle to center to the femoral head. Once this has been done, autocomplete can be selected, and the SmartKnee Wizard tries to identify the anatomical axis of the femur, putting up the blue magnifier in order to make any final adjustments, just placing the handles on the cortex, and then adjusting and finessing the positions on the knee joint. Zoom in on the blue lens to get a closer look at positioning. The dark blue line should be positioned at the top of the tibial plateau and the bottom of the femoral condyles as best suits the anatomy shown in the image. The central handle needs to be positioned in the midpoint of the joint as it controls prosthesis position when shown in the templating screen. Also, this reference point is used for identifying the valgus angle between the centre of the mechanical axis and that of the anatomical axis. Click on the question mark meter to set a preferred valgus angle for prosthesis positioning, or use the one calculated. By right-clicking on the wizard to obtain the Properties menu, femoral or tibial cut depth handles can be selected. These green handles can be adjusted to measure cut depth from the bony anatomy, and they originate from the marked 1 centimetre cut line. And they're reported here on the left, along with your measured angle, any change of a user set angle, the width of the tibial plateau, and the femorotibial angle. Click the spacebar to remove the magnifier, and to measure mechanical axis deviation for best accuracy, deselect SmartKnee and select the Mad Wizard, utilising the already known hip and ankle positions, just repositioning the handles across the tibial plateau width to suit. This is not constrained to 90 degrees as the SmartKnee Wizard is, giving a slightly more accurate mechanical axis deviation, which is recorded here and shows out of range in red. The tibial angle is also depicted here. Replacing the SmartKnee Wizard and minimising this image in order to look at other image options. As we move to the short AP, should this also be required, or if this is the only AP image, it will take, if SmartKnee's been used, the value that was shown on the SmartKnee Wizard. It needs to be positioned with the rectangular box on the anatomical axis of the femur Just identify the best straight part of the femur shown and then position this across the condyles. Valgus Angle is taken from SmartKnee settings and can be changed to a user preferred setting by clicking or set in preferences. Choose the tibial and remove the Femoral Wizard, positioning this on the anatomical axis of the tibia and positioning this part across the top of the plateau. And also there is a value for the axis offset between the tibial plateau and the anatomical axis, which in some cases may be significant if a long stem is to be positioned. If we want to measure again tibial cut depth, it's also possible here, and if the resolution of this image is better, slightly different values may be obtained, as shown here on the left. Minimizing this image and going to the lateral, we have the Femoral Wizard. Take the two-part handle, drag it so it's approximately parallel to the anterior femoral surface, position it there with the 4-point handle, and then take this posterior square handle to cover the most distal and posterior part of the condyles. A value is shown to size the femoral component. Finally, tibial component is identified for a position using the anatomical axis and the tibial plateau. The posterior slope has taken the default value that can be changed if needed. That completes all knee wizards. Those used will depend on imaging protocols. Now we move all images to templating and look at the sizes suggested. Sizing for the femoral component is taken from the lateral, and a choice is made between standard and standard plus. Standard may be appropriate in this case, using the small arrows to change the position as it looks quite large on the AP view. To complete the template, choose something in the red box and the keel type, and then it becomes dark. There is an extra function available in the long leg, which is the reduction tool. Choose the knee reduction button to show the mechanical axis that is likely post-op, although the insert cannot be selected from this particular view if it is available in the manufacturer's drawings. It is a guide to outcomes. Depending on which views you wish to see saved to the packs, leave them in the view that you're happy with, make any small adjustments perhaps that you require, and view the report. All measurements are listed here along with the replacements that have been selected, plus X-ray details. It's possible to print or save this out as a JPEG to a local file, but the typical method is to save or commit to the packs. This completes the video tutorial on SmartKnee and its facilities.